the 19th of October. Now, there's some pretty definitive information coming out from the Office for National Statistics in the United Kingdom, which applies to everywhere in the world. So we're going to look at that. Now, yesterday we looked with great gratification, really, on the reduction in cases in the United States, which looked good. But we looked with some concern, it has to be said, at the significant increase in cases in the UK. So I want to start off with that now and look at why this probably is. So starting off with higher infection rates in the United Kingdom. Lower functional immunity in our population than most other Western European countries. So the functional immunity, because we seem to have had some waning because our vaccine programme started early. So we had an early vaccine rollout. We know there is some waning. The slightly later vaccine rollout in a lot of European countries would mean that they still have higher levels of functional immunity. And in the United States, we believe there's been a lot of herd immunity through natural infection. So that could be a big difference. And of course, the AstraZeneca vaccine protects slightly less well than the Pfizer vaccine against the transmission, particularly of the Delta variant. So the Pfizer vaccine is, at the moment, we don't know about the longevity particularly, although they seem to be waning off with approximately equal levels of reduced efficacy. But the Oxford AstraZeneca vaccine, people that have had that are somewhat slightly more likely to become reinfected than people who had the Pfizer vaccine. And of course, the United States has been predominantly Pfizer and Moderna. Europe has been predominantly Pfizer, whereas the AstraZeneca vaccine has offered slightly less levels of protection, particularly against the Delta variant. Slightly lower overall vaccination coverage, particularly vaccination of teenagers. So the main area of spread in the UK at the moment, the main population group is like 11 to 16-year-olds, school-age children. In the UK, the vaccine uptake amongst this group is relatively low. In Europe, it's much higher. Having said that, in the United States, it's not very high there either, but they've probably got more natural herd immunity than we have in the States. Fewer social restrictions in the UK compared to Europe, certainly, but this is a big one. In the UK, we're testing a lot more. So there's no question that we are simply picking up more cases in the UK because we are testing more cases. Now, next thing we want to look at is the effectiveness of the vaccine doses versus natural infection. Now, we have looked at this before. 2 vaccine doses give similar protection as previous infection, according to the ONS. So this is the ONS thinking here. So ONS is saying that 2 doses of vaccine are similar to natural infection, but frustratingly, they don't give the figures. Well, they do. They give a spreadsheet with thousands of data points in it, but it's not intelligible to the likes of me anyway. So they're saying basically it's similar. So that's the kind of the headline statement. 2 vaccine doses, similar protection as previous infection without vaccination. Now, they say that 2 doses of either Pfizer-BioNTech or Oxford AstraZeneca vaccine provide a similar level of protection as having previous natural infection of coronavirus. So that's true, but we do know that the Oxford AstraZeneca is not as good as the Pfizer at the current time period. This is during Delta variant time, so this is up-to-date information. And of course, this is going to apply anywhere in the world. Vaccination reduces the risk of testing positive, of course. Both when the Alpha variant was dominant in the UK, which was 1st of December 2020, stretches your memory, doesn't it, to the May 16th. So that was the Alpha period of time. And also when the Delta variant was dominant, 17th of May, to when this data was collected, 14th of August. So good levels of coverage, but we know again slightly not as efficacious as against both vaccines. Neither vaccines are as efficacious against the Delta variant as they were against the Alpha variant. There's a slight reduction. Now, Office for National Statistics again, and it gets interesting in a minute and a bit complicated, it has to be said, but stick with it. 2 doses of Pfizer-BioNTech vaccine reduces the risk of testing positive by 73%, according to ONS. 2 doses of Oxford AstraZeneca vaccine reduce the chance of testing positive by 62%, according to ONS. No question about it. ONS vaccine is not as the Oxford AstraZeneca vaccine, as reported by the ONS, is not as effective. 3 weeks after vaccination, 2 doses always more protective than 1. And for the 2 vaccines, 3 weeks after the second dose, it averaged out at 75% protection. After only 1 dose, it averaged out at 58% protection. And that's with the Delta variant. Now, I'm surprised that 58 is as high after 1 dose, to be quite honest, but that is the Office for National Statistics figures. Now, this is where it gets interesting, because this Office for National Statistics data, it has to be said, it is inconsistent with the COVID symptom tracker, ZOE data. Now, this is unusual. There's been great consistency between the data sets up to now. This is the first major divergence between the the Office for National Statistics and the COVID symptom tracker ZOE study, the King's College study data. So they say 2 Pfizer doses, 87% protection against infection. So that's looking better. AstraZeneca, they agree it's not as good, but they still say it's 71% protection. So remember, that's against 73 for that one and 62 for that one with the ONS. So COVID symptom study indicating higher vaccine levels of efficacy. Not massive differences, but significant given the number of people involved. But this is where the big difference comes in. Rather than being the same, which the ONS say it's the same, natural infection alone with the COVID symptom tracker data only gave 65% protection against catching it, against infection. So less than both vaccines, according to the COVID symptom tracker data, but the same as having 2 doses of vaccine, according to the Office for National Statistics. This is a clear contradiction. So which one is right? Well, basically, I don't think the COVID symptom tracker data is accurate here, because I'm going to give you further evidence now for this. Now, we have looked at this before. Really very interesting data. Now, this is Israeli data. This was the name of the study here. Previous protection of SARS coronavirus 2 infection is similar to that of Pfizer vaccine. So basically, the Israeli data is consistent with the Office for National Statistics, but inconsistent with the COVID symptom tracker data. So the COVID symptom tracker data is the odd person out on their own here. Therefore, I think it's less likely to be as accurate. Vaccine was highly effective. Now, the Israeli figures give even greater vaccine efficacy than the Office for National Statistics. So again, an even greater vaccine efficacy than the COVID symptom tracker data. So they're saying protection against infection 92, but people pretty well agree on these. Protection against hospitalisation 94, severe illness 94.4, and 93.7% protection against death. So these tend to stay more consistently high across the vaccines and across the studies. Protection against prior SARS coronavirus 2 infection. Well, they're saying it's about the same. So protection against infection from people that have had from protection against reinfection from people that have had the infection but not had a vaccine, 94.8, so slightly better than the 92.8 provided by the vaccine, but good protection against hospitalisation and severe illness. So there we go. We see consistency between the Office for National Statistics and this was a large-scale population study in Israel, but inconsistency with the COVID symptom tracker data. Therefore, we conclude that the Pfizer vaccine is giving higher levels of protection at the moment than the Oxford AstraZeneca vaccine. That's why people are getting a booster dose very often of the Pfizer vaccine in the UK now. But we do see that natural infection and 2 vaccines are providing similar levels of protection. What everyone agrees on is that if you had the natural infection followed by 2 vaccine doses, you're hyperimmune. What I believe is almost certainly going to transpire to be true is that if you had 2 doses of vaccine followed by a reinfection, that's also going to provide a massive immune boost, but we don't have the actual data for that yet. So I hope that made sense. We're seeing that natural infection immunity, vaccine immunity, similar at the moment. Now, I suspect, and again, we don't know this because the time hasn't simply elapsed yet, I suspect the natural immunity from the natural infection is going to last longer than the vaccine immunity, but we don't know yet. That's just my suspicion. Now let's just look at a few graphics from Office for National Statistics. These are remarkably useful graphics here. So this is a number of deaths registered. So this is the proportion of deaths from COVID-19 versus the total numbers. And we'll look at this again in a minute, but the total number of deaths is above the 5-year average. So we see the previous winter here with very high levels of COVID deaths, lower, but we'll see that more precisely in a minute. But that gives a good sort of graphical representation of the proportion of deaths that are attributable to COVID-19. Some of these deaths, of course, would have occurred anyway. Now, this is interesting. I haven't included this before, but it actually really grabbed my attention, this. The well-being survey from the Office for National Statistics. How are you feeling? So, OK, it's out of 10. It's subjective, of course. Out of 10, how are you feeling? So, satisfied with your life nowadays, the average has gone down. People seem less satisfied with their lives in recent times. Overall, to what extent do you feel that the things you do in your life are worthwhile? Again, a slight reduction, has to be said, this year, in 2021. How happy did you feel yesterday as a snapshot? Well, again, happiness levels down a little bit. And this one that's concerned me most, anxiety levels up a fair bit, so from 2.85 to getting on for 3.4 people rating their anxiety score for the previous day. So higher levels of anxiety, not what we would want. 93.6% of adults testing positive for antibodies. That means, I think, that more people than that have been exposed, because some people, the antibody levels wane so much that they no longer test positive for antibodies. So fairly high levels fairly high levels there. Social distancing, people have decreased. Now, I must say, just from my personal experience going out and about in normal life, people are wearing masks much less. People are social distancing much less. In fact, a lot of times it feels like pre-pandemic times. So I think that is a minimum estimate from my experience in the UK anyway. But interesting to see that the Office for National Statistics actually quantify this. So I thought that was a pretty interesting graphics. Now, just briefly, a couple more things. All deaths registered in the week to the 8th of October, again in the UK. COVID-19 deaths fall in England, Northern Ireland and Scotland, but up in Wales. So the overall UK figure, deaths are down. Total deaths in the UK for the week up to the 8th of October were 4,090 deaths, 14.7% above average. And this variation from the average deaths is probably the most accurate. Now, it's not accurate from week to week because we have this phenomena called displaced mortality, where people can die a few weeks earlier than they otherwise would have died. But overall, it's a good indicator, and we do see that deaths are up overall on the previous weeks in the previous 5 years. And this is significant, not because of the 1 week, but because of the overall trend. In the week, 280 deaths involved coronavirus, down from the previous week. Deaths involving COVID-19, 1 in 15 deaths in the UK, 6.6% of all deaths. So it's still pretty high. And this includes non-residents in the UK. And finally on this bit, prevalence is high. There's no two ways about it. Prevalence in the UK is high. Thankfully, that's only transposing into modest rises in hospitalisation, but it's rises we could do without. But the big thing is we're starting from a high prevalence level now as we go into autumn. And as you can see from outside here, autumn, it is, the leaves haven't quite turned yet. Some of them are actually, they're starting to go brown a bit now, but we are definitely into autumn and we have a high prevalence. We have a high kick-off rate for the winter. So 1 million people in the UK countries had COVID-19 in the last week. England, it was 1.63% of the population. That's 1 in 60. It was 1 in 70 the week before. Wales, it's 1 in 45 people, 1 in 55 the week before. Northern Ireland, it's 1 in 120 people. It was 1 in 130 the week before. In Scotland, 1 in 80 people. 1 in 60 people the week before. So we are still seeing high levels. So 1 in 60 people still had the infection in any one given week in the UK. In fact, that was the week up to the 8th of October. So that's all I wanted to say about that, really. Now, I've just got a couple of other things I want to mention. I've had reports from Greg and Dr. Peter, who we talked to recently. I'll just read this out from Greg, just to let you know that one of my posts referring to your video on aspiration has been pulled from LinkedIn. This is the first time one of my posts has been pulled, and I have put out some pretty controversial posts on other subjects, says Greg. And I was astonished that brilliant science, no two ways about it, brilliant science that Peter and I discussed a few days ago, was pulled from LinkedIn. That really is inexplicable. We talked pure, good quality science from one of the leading microparticulate scientists in the world. So the fact that good science has been essentially censored concerns me. That concerns me. We're not rubbishing anything. We're not saying vaccines are bad. Far from it. Far from it. We're just saying there's a safer way to give it. And that's been censored. Based on, this is a PhD pharmacologist who's reported this to us, leading expert in his field, and yet LinkedIn seem to know better than the world's greatest, one of the probably top dozen people in the world in this subject. Concerning. Now, the other topic I've got here is feedback from vaccine manufacturers, because quite a few of you have had the good initiative to write to vaccine manufacturers and say, look, why don't you recommend aspiration prior to your vaccinations? And the replies have come back confidential, so I can't read them out to you, which is fair enough. That you can just say an email's confidential or not, but I was a little surprised they were confidential from the vaccine manufacturers. But the bottom line was they basically seem to be allocating responsibility for doing the intramuscular injections to the clinicians, because of course they don't want to get into trouble if anything goes wrong. So vaccine manufacturers somewhat quiet on this because they delegate the intramuscular injection to the clinicians, but they do say it should be an intramuscular injection. And I say, to be guaranteed it's an intramuscular injection, you need to aspirate. Now, finally, we're going to go to a report from Australia. Dr. Summerden in Sydney is going to talk to us now. So Summerden, as always, thank you very much for your report. And we'll go over to that now.
Hi, John. I'm Dr. Sumati Mahen, a general practitioner from Sydney, Australia. I'd like to share a brief update about the COVID situation in Sydney, in New South Wales. Since I spoke to you last time, we had a terrible situation in Sydney. After 100 days of lockdown, now we have some happy news to share with. Appears like we have seen the light at the end of the tunnel. We have some data to share it. Here, the first wave of the peak, which is March and April, it's quickly, we brought it under control with the mask distancing and the public health TTIQ, which is testing, tracing, isolation, and quarantine, which is designed to achieve COVID-0, which worked with the first original COVID epidemic. Until we get the Delta wave in June, we had to do a complete lockdown. When we see the Delta wave curve, closer look, as you can see, with all possible measures to control the case numbers down, including complete lockdown, but the cases start spreading is so fast. We did the TTIQ, again, testing, tracing, isolation, and quarantine measures in the public health. With the Delta wave, it's very time consuming, labor intensive, and unsustainable. But we continue to do that in order to slow the spread of the infection so that hospital can cope up the admissions and while we were waiting for the vaccinations. Initially we had some vaccine supply, but when we get the vaccines, we increase the vaccine rate so quickly, so rapidly, we started chasing the cases with our vaccine rates, and we override it, and we brought the curve down, went down again. The next slide, self-explained about the hospital admissions. In 18th of October, we have 606 cases in the hospital, and ICU cases 132, which drawn in the orange graph, and ventilators 71. You can see the proportion of hospital admissions and the proportions those who needed intensive care and ventilators. This is the cases by age group and the life lost by age group. As you can see, the highest number of cases between 20 to 29 year age group, whereas you can see the 80 to 89, very small number. But the life lost, as you can see, 80 to 89-year-old peaked. This almost looks like a mirror image. So that tells you when the old people get the infection, the mortality rate is very high. And this is the vaccination status compared to nationwide. The blue line is New South Wales with first dose 92.6%, whereas nationwide 84.6%. And New South Wales reached 80% of double dose vaccinations, where nationwide 67.8%. New South Wales is considered one of the most highly vaccinated society in the world. I'm sure other states will follow us soon. The treatment options. You can see the vaccination is a frontline protection for everyone. The treatment, we have 2 antiviral treatments that are soon available. One is Molnupiravir. We have purchased 300,000 doses due to arrive in 2022. And the Pfizer are making an oral antiviral combined drug, soon be available in 2022. And Australian government ordered 500,000 doses of Pfizer oral antiviral drug. Now is in clinical trial pending for therapeutic good administration's approval. And the other one is to prevent the severe infections. We have monoclonal antibodies. We already have Sotrovimab currently used in Australia. We have 31,000 ordered, and we have 20,000 already in the hospitals, mainly 3 main states, New South Wales, Victoria, and ACT. And this other one is Ronapreve. Is an Australian government has already purchased 15,000 doses. This is a monoclonal antibody made by Roche, awaiting again therapeutic good administration's approval, and it will be ready at any time this month. It's given by the intravenous in the hospital setup. Results in 70% reduction in the likelihood of hospitalization and loss of life. Of course, very severe cases are in intensive care. Remdesivir and dexamethasone are used in intensive care situation. So now in summary, lockdown restrictions we have eased off since 11th of October, where COVID safe measures are in place, and those who are double vaccinated. The factors will keep COVID-19 cases low in Australia with non-pharmacological measures and the high vaccination rates. And we are following the COVID safe rules with the health support and the community support. And with the high vaccination rates, our herd immunity will start kicking. We are in spring heading to summer. So people open their windows and more ventilations. People go backyard and go out more. And we are continuation of monitoring the hospital admission, which is very important to follow up. And now we have also treatment available in coming months. So we are slowly getting our pre-COVID lifestyle back. I feel like saying to John, yes, we have done it again. Thank you.
Somebody, thank you very much again for that. And I must say, I agree with that conclusion. I'm quite delighted. New South Wales particularly, which of course was the epicenter of this recent outbreak, very high vaccination uptake rates, very encouraging. And as Dr. Summerdin correctly says there, that's going to give rise to herd immunity. Hospitalisations down somewhat, vaccinations up nationally as well. So Australia's buying lots of expensive molnupiravir. Okay, that's fine. Interesting to see if that gets approval. And of course, remember, Australia do their year the wrong way round, so that they're actually they're in spring now, and they're going into summer. So that is also going to be on their side. So I must say that report and my general thinking about Australia recently is quite a cause for relief. Actually, it did look pretty uncertain for a period of time when Australia did so well for such a long period of time. Then the Delta variant, thought, oh heck, what's going to go wrong here? And the measures that they've taken, combined with their very, very rapid uptake of vaccine, does seem to be bringing the cases and hospitalisations down. Still a bit to go, but as Summerdin says, it looks like they've done it again. So congratulations, Australia. You have done remarkably well, and thank you, of course, Summerdin, for that excellent, concise, numerical, quantitative report. And thank you for watching.